Hello everyone, it's Raymond from TooHealthTalk. Welcome to another episode. On today's episode, we're going to be talking a very, very special topic. But before I continue, I'll plead, if you want to support what we're doing here, please subscribe, like, and share this video. So let's go back to the deal. On today's episode, we have a very, very special guest, and we're going to be discussing a very important conversation. Let me emphasize on that, a very, very important conversation. TooHealthTalk is where we discuss real health challenges, real health conversation in a very, very simple way. So on today's episode, we have the one and only Chijioke, Dr. Chijioke, a physiotherapist. Welcome, doctor.
Thank you very much.
Yeah, so today's topic is a kind of a very controversial topic because it affects a lot of people I know, and most people don't like to talk about it. But on this show now, like the main goal of TooHealthTalk is to come up with so many conversations that affects our daily lives, and we've prided ourselves in bringing this conversation to life in a very simple way, in a very simple simple language and all. So today we're talking about period pain. This conversation about period pain, I've been having this conversation with most of my colleagues before now, asking them, females have period pain, and someone talked about physiotherapy coming in, and I was like, oh wow, that's strange. So I really want to know, what is the job description for a physiotherapist when it comes to period pain?
Good. So I can go ahead and answer that question. And I would like to say that physiotherapy is basically the healthcare profession that uses non-pharmacological and non-invasive means to bring about pain relief, to bring about optimal performance, to bring about improved mobility. So whatever it is that causes you pain, affects your movement, or whatever it is that the doctor says that you need exercise as part of the treatment, that's where a physiotherapist will come in. So period pain, it's not just from an assumptive view. Period pains, scientifically, there have been a lot of studies to show that there's a lot we can offer. There are a lot of things that we can do as physiotherapists to help ladies who are having period pains. So, yes, I have personally been able to talk with a lot of people, give them advice, tell them some home remedies they can be using, and they've seen wonderful results. So yes, we have a lot.
So now you're saying that physiotherapy can really help with period pain.
Absolutely.
So how?
Now, there are many ways we can help. There are many ways physiotherapy helps. Okay? And it is by identifying what is going on in the body of the person who is having the pain. Right? Identifying certain issues that are either causing the pain or that influencing the perception of pain. I will explain this. And, first of all, part of the role that we can play is by initiating certain conversations around what is going on in the woman's body. One, a woman who is having period pains, if it has been examined and we know that, okay, this is not so severe, and we are not suspecting any organ involvement. So that's where we come to something we call primary dysmenorrhea. And that's what we get involved in a lot.
So before you continue, so are you saying that if a lady is having a period pain, they're supposed to meet a physiotherapist first before a gynecologist?
No. Now the thing is, there's an intensity of pain that is normal. There is not so much of a problem. It's cramp. It's just pain, But when this pain begins to affect your daily life, begins to affect everything you're doing, begins to affect your movement, or you begin to throw up, or you can't move, you're lying down all day, and then this pain is unusual. I mean, it's so much. The pain is literally consuming you. That's where you have to seek professional help. However, you are not meeting the physio, you are not going to meet the physiotherapist. In fact, even if you meet a physiotherapist, the right thing for the physiotherapist to do would be to refer you to your gynecologist. So you're meant to go to your gynecologist when you know that, this is not usual. It's not usual. There are ladies who experience minimal discomfort during their periods. There are ladies who experience minimal pain. But there are some that the pain is literally excruciating and it affects their quality of life. It's really severe, and then you are seeing other symptoms, you are seeing other things like excessive diarrhea, vomiting. I've seen people vomiting, some people throw up blood, different things happening at that season. So in that case, you would need to go and have a proper scan done, initiated by your gynecologist, okay? And then they'll be able to rule out what's happening within the woman's body, what's happening to the organs, what's happening to the tissues, okay? But then if you're having period pain, but it is the usual period pain, it has been assessed, examined, and it's not something that is considered so serious, right? There are certain conditions that can be ruled out, and if those are not the issue, and that's why I mentioned something earlier, primary dysmenorrhea, then those cramps, that discomfort, that pain that the woman feels at that part of her season, that season of her flow, the physiotherapist can actually do a lot to help. Now, even for the cases that I mentioned, when there's issues with the organs, there's something going on, there's still a lot that we can offer. There's still a lot that we can do in that phase. But the primary care is for the gynecologist to decide. Okay? There's a lot we can do for secondary and primary dysmenorrhea. But what I'm talking about now is what we can do for the discomfort that women experience or ladies experience during their period.
So what's the exercise that you guys give for period pain?
So now exercise is one. Exercise is one. And it's not just about, saying this type of exercise. There are different activities that can be done. But the good thing is, or let me say the main thing is, the woman observing her body and knowing what works for her. There are some women that in that period, when they are having the cramps, just walking eases the pain. Just walking eases the pain. For some other activity, maybe climbing stairs or jogging or something, some maybe push-ups, whatever, that works for them, for their bodies. However, there are some people that it doesn't really work for. So there are many other alternatives that can be explored. To help remedy period pains, which we can help to instruct or tell the lady what to do. Can I go ahead and mention some of them?
Sure.
Okay, good. Now, one of the remedies, one of the options that can help for the lady is hot packs, or let me just say thermal therapy. So this is basically using either hot or cold to affect the way the body perceives pain. Now, hot packs have been incredibly useful for a lot of ladies, and I'll suggest the purpose of this is it's important for a lot of ladies. One of the reasons why we're having this conversation, why this conversation is important, is because a lot of ladies, they experience the period pain, the cramps and all that. It gets uncomfortable, it can make them become moody or, want to stay off work or something, reduces productivity and all. Now, what some ladies do is that they resort to pain medications.
Yeah, I was also going to come about like that part of taking
Exactly.
pain medication and visiting a physiotherapist.
Yeah. So now a lot of them resort to pain medications because they've not really explored other options that can help reduce the pain that they are feeling. Now some others get addicted to those pain medications. So we don't want it to like be the first point of call. You have to exhaust the conservative options. Try out different things and
So
see
like
what works.
visiting a physiotherapist before taking pain relief is better.
Now, I wouldn't even say visiting a physiotherapist. This thing I'm saying is not like hidden in codes, right? Getting a consultation or getting an opinion from a physiotherapist or visiting a physiotherapist could be of help. Even in putting a phone call through, oh, this is what's going on. What can I do? Can you, administer this, or can I try this for myself? And they guide you on what to do. That could help. So I talked about thermal therapy using there's this hot water bottle, not like this plastic bottles, but they're in tubes. I would have brought one today if I had remembered. It's like the favorite ladies' companion. If you go online and you type hot water bottle for ladies, you're going to see that you see a lot of them. Some of them are quite colorful, looking aesthetic, but it has like a rubber tubing, and then it's covered with a cloth pad. So you just put hot water inside. The heat is absorbed by the tube, and then it radiates, and you can just put it over the tummy, over the abdomen. So it can help to relax the tissues that are there. Now, where we can come in is to manually, do some manual techniques, to use some manual techniques to alter the way the body perceives pain. Now, some kind of massage techniques can help.
So massage can help during
Yes,
period.
yes.
Wow.
Some kind of massage techniques can help, especially, if administered correctly. Now, what happens sometimes is because it's the uterus that is, contracting. Now, there's the body of the woman is a chain. It's like a connected web, right? So, if this contraction is happening in the woman's, organs, the surrounding tissues are going to be responding to the contraction. So you can even have tight pelvic floor muscles alongside painful periods. So that's why having an examination, seeing a pelvic floor physiotherapist can be of extra help to rule out those musculoskeletal connections. What do I mean? Muscle and soft tissues, ligaments, that are connected to that whole system. So now, if there is tightness of the pelvic floor muscles, the muscles of the pelvic floor, and these are, I'll talk about that later. But if there's tightness of those muscles, the tightness can actually lead to increased sensitization. It will alter the way the woman perceives the pain that is happening there. And that's why you see a lot of times the person is complaining of pain, not just in the tummy, but in the lower back, in the pelvis, and all that. So if there's associated tight pelvic floor muscles, the physio can actually help to release those affected muscles. I've talked about that. There's also kinesiotaping. Kinesiotaping is very instrumental. A physio can help administer that, and a physio can also teach you how to do it for yourself if they really want to help you. So a physio can help administer that. It's this elastic. These are elastic therapeutic tapes. You see it very commonly used among athletes. If you watch footballers like Bill, Cristiano Ronaldo, and the rest of them, you see some of those tapes, maybe blue or black, that they plaster on their bodies. It's called kinesio tape or kinesiology tape.
Wow.
So that can be applied at the back. There are different techniques for application. I actually do apply that, and it has significantly shown amazing results. That's shown significant results, I meant to say. So that's one of that. Another one is TENS. A TENS unit, a portable TENS unit. A TENS unit looks just like this device, as small as this. The ones that are actually portable, they are bigger ones. but a portable tension unit is as small as this, can be used when placed in the right positions by the physiotherapist. It can actually significantly reduce period pains, and these are options that are considered very safe for the lady, contrary to the regular administration or regular use of pain killers. So there are many others. I believe I'll chip in some of them as we go on with the conversation.
So can tight pelvic floor be mistaken for hormonal issues?
Well, I wouldn't say it can be mistaken for hormonal issues. However, I would say it can have, I mentioned that already, it can have different consequences for the woman, for the lady, can have different effects. Now, tight pelvic floor muscle can mimic back pain. Tight pelvic floor muscles can affect respiration and breathing. Tight pelvic floor muscles can affect, the core muscle strength, the strength of the muscles around here. And it can also, there's something we call irradiation, Now, there's a principle by which, let's say, a muscle that is bearing weight or a muscle that is tense in a particular region affects another muscle. It's more like a chain. They're all interconnected, So a tight pelvic floor muscle can cause an anterior pelvic tilt, can cause a tilt in the woman's pelvis, which can actually affect her lower back. Increase, it will reduce the curve in the lower back and cause low back pain or increase risk of straining the back.
Oh.
It can cause tightness of the muscles in front. It can affect the muscles in front. It affects the abdominal muscles and cause more pain because those muscles are always contracted. Oh. So the role, what we try to do is to observe and see the associated bodily changes with the period pain and try to intervene where necessary. So I wouldn't say that tight pelvic floor muscles can be mistaken for hormonal changes, hormonal imbalance.
So now we are talking about pain.
Yeah.
So going to childbirth now, like if physiotherapy handles everything pain, so how does the physiotherapy comes in when like women have pain, maybe after childbirth or during childbirth? Beautiful. So like how can a physiotherapy help?
Beautiful. Well, let me first of all correct an impression. Physiotherapy doesn't come into all kinds of pain. We don't come into all kinds of pain, but I can still argue for that statement to say that we do, because it's not, our role is not just to manage pain. If we are working with a client, we are looking at a holistic end game, a holistic view. So even if we do not directly try to reduce the pain, what are the things that we can do to help administer or to help, improve the person's quality of life? Okay, and eventually there are some things that you can improve, and that improvement can lead to a reduction in the pain or making the pain better. Now, having that said, for women, physiotherapy is essential. It is very necessary for every woman in her reproductive phase or reproductive season. Now, from the point of conception, all through the period of pregnancy and even afterwards, the woman needs at least to consult with a physiotherapist.
Why?
Or to keep visiting physiotherapists, or to have a physiotherapist instructing her antenatal classes. And there are many reasons. Remember I said improving movement or mobility, reducing pain, instructing exercise, or delivering or prescribing exercise. Because when it comes to these three pivotal areas, physiotherapy is the leading profession. It is our responsibility, it's our duty to prescribe exercises, to know what exercise suits which person, to observe at different points in her trimesters, the first trimester, second trimester, third trimester, to know what kind of exercise is suitable for the woman, because there are innumerable benefits to certain movements, to certain activities for the woman. Now, come to when the woman is advancing. When it comes to posture, positioning, because a lot of pregnant women, when they sit, they tend to sit with postures that could be harmful for their backs or the neck. For some, even using their devices, you see something like this. Now, these are some of the things that we try to teach and correct from the early stage at the antenatal classes. We teach sex position during pregnancy, safe sex positions during pregnancy, because, these things are important. Whether it is lying position or sitting or standing or lifting or washing, there are different things that the woman needs to know, and we teach. Now, beyond that, anything that's causing the woman pain in her body, because when the woman is pregnant, obviously there's going to be a slight deviation in the way her body, the arrangement or the structure of the body, right?
Yeah.
So, because of that deviation, the mechanical alignment has been adjusted. The woman's center of gravity changes. So, one, she may be having a lot of back pain, neck pain, shoulder pain, all those aches and pains. Now, a physiotherapist knows safe ways, especially one who is trained in that regard, knows safe ways to help the woman reduce the pain that she's feeling during all through the stages of pregnancy, without depending on pain medications, which would be harmful for the baby and for the woman herself. Now, beyond 20th week of pregnancy, most gynaes, most doctors, most attending birth professionals would not want to be administering pain medications. They want to cut down or taper down or reduce the dosage. By the 30th week, it's almost anathema. It's almost like a crime to give a woman painkillers by the past 30th week. So what is she left to do? If that pain that she's feeling, she's being told, Mama Nkechi or Mama whoever, just continue. When you give birth, it will go. Pain is a normal part of pregnancy. No, I do not believe that. I don't believe that pain is a normal part of anything.
Wow.
Pain is not a normal part of pregnancy. You are not meant to be going. Pregnancy is a lot of work already. You are not meant to now go through that entire journey carrying one pain that could have been managed. So we use safe means. Remember, I said non-pharmacological and non-invasive. Did I even say? I don't know. But non-pharmacological and non-invasive. So we do not give you pills. We would, not that we don't, we would most likely not give pills. We will most likely not cut through her body or use needles or injections or any of that. So we can find ways, creative ways. Some of these things are given by nature. Water, that's where you hear hydrotherapy. We can use heat, thermotherapy. We can use sound, sonotherapy, ultrasound, sonotherapy. We can use different things to help bring about improvement for the woman in terms of pain and mobility. So yes, at every stage, even in labor and delivery, it's a whole lot. I could do a 10 days lecture, but let me quickly say this: labor, delivery, and postpartum. So there's like 3 categories. 1, prenatal or antenatal physiotherapy. The antenatal period, what should the woman be doing? What are the pains she's having? What are the dysfunctions, movement dysfunctions that we are noticing in her body, so that we can address those dysfunctions or those issues? 2, from the point of, from let's say midway, by 2nd trimester, the belly has protruded, down to delivery. But let me not even talk about that. So let's say antenatal, prenatal covers all of that season. 3 months. 9 months. So there's prenatal period from the beginning till the 9th month, when the woman is now in labor. So that labor phase is what I would call peripartum or parturition. So at this point, the woman's body, everything in her body is about letting this baby come out.
Oh, yeah, true.
Yes. So peripartum, there's peripartum physiotherapy, helping to guide the woman's body to go through less pain, less discomfort, more ease, more safety, more comfort while she does that journey. Now, there are many things we can do at that point to help. Many things that we can do to instruct. Many things. We can even use the same TENS unit I talked about to bring about pain relief during labor. In many advanced countries, in many advanced climes, they do that. They allow such options to be used during labor to reduce pain significantly. Now, that season passes, that window closes from the moment the woman is in labor to the moment she gives, she puts to bed, right? And after that, another season opens, and that is postpartum. The moment the woman gives birth, and then down through, say, 12 weeks, right? Oftentimes, 12 weeks. Some authorities will say 6 weeks. But the main thing is that we're looking at what happens to the woman's body. All through, it's been the woman and the baby. Now the baby is out. It's not the woman alone. So what's happening to the woman's body as a whole, and how can we come in terms of pain management, in terms of pelvic floor examination, which is very important. I would recommend that for every woman who gives birth, at least after 2 to 3 weeks, should do a pelvic floor examination by a pelvic floor physiotherapist or a pelvic floor certified physiotherapist. Okay, so that's like on the whole. There are many things that we can do, helping the woman to get back to shape, become fit again, get back to work after putting to bed. Okay, as well as any other thing that came as a result of the process of birthing or the process of labor and all that. So yeah, it's a long list of things that we can offer. For pain, there's this stuff in my head for pain. Like, I think for young girls, do you think that they get to underreport their pain? Okay. In terms of what kind of pain?
Period pain.
Oh, back to period pain. Now, yes, young ladies usually underreport their period pains. And I would say generally, African women, from my own observation, and maybe from research, I don't know, but African women tend to underreport their period pain. Why? There's been this kind of cultural context to it, and then we live in the part of the world where people tend to do competition with suffering.
Yeah, true. Mostly in Nigeria, yeah.
I suffer past you.
Yeah.
How can you be saying, you look at the older generation of mothers, and they are looking at the younger generation of ladies, and then they are telling them, you cannot be sitting down all day, you cannot be doing this one all day. Is it not just this? Not knowing that pain is subjective. The way you receive pain or perceive pain may not be the way I do. So when you look at the person and say, no, you are not moving around because you are lazy, you are trying to avoid work or something like that, the next thing, the person will start taking it to themselves. They wouldn't want to tell anybody that they are in pain.
Yeah, true.
I work with ladies a lot. I've always worked with ladies, of course, in most settings. And then, you see a lady and she's uncomfortable, she's lethargic, she's not, definitely something is wrong. And she's walking. And you ask, what's the matter? Can I help? What's going on? Are you all right? And they're like, no, I'm fine. I'm okay. It's just. And that is just me. I know it may not be something I'll be able to bear. The person may be carrying a pain on a threshold on, a score of 7/10 on a numerical pain rating scale. And then they're saying, I'm fine.
Yeah.
I'm fine. Meanwhile, it's because of expectation. Other ladies are not complaining, so why should I complain?
So there's this. I was also talking to one of my friends, and she was talking about PCOS. So PCOS pain. So I want to know, can physiotherapists come in for PCOS related pain?
Of course. Now, this is the thing. Initially I was talking about primary and secondary dysmenorrhea, and when there's organ involvement, when there's serious pathology like PCOS, polycystic ovarian syndrome, or endometriosis, it is very, very important to properly screen to confirm. It's not something that you can just assume. So in that case, it's going to be a multidisciplinary management. There are studies to show that while physiotherapy is not a primary intervention for PCOS, it means that someone who has PCOS and is having menstrual period pain should not go and meet a physiotherapist. The physiotherapist is not the right person you should meet. You are not going to get physiotherapy treatment. You should go to the hospital, get evaluated, probably by your general practitioner, send you to your gynecologist or to the gynecologist who will eventually, do the proper referral systems and do the right prescriptions and all that. But if all that have been done, it's also important to still, involve a physiotherapist in the management. There are some movement dysfunctions or musculoskeletal issues that can happen as a result of an organ injury or an organ pathology. It means that even for PCOS, there are some people living with PCOS that have pelvic floor issues, linked to that. They have associated pelvic floor issues, be it sexual dysfunctions or pain, pelvic floor dysfunctions. So that would obviously be causing more pain, be altering the way they perceive pain, and making their lives, making the pain more unbearable for them. So coming in as a physiotherapist to help identify those surrounding problems and offer the right kind of treatment will obviously make their lives better. So it's now the pelvic floor physiotherapist or the pelvic floor rehabilitation specialist, that's a physio, or the women's health physio or obgyn physio, that can help do the assessment, observe, do the assessment, and offer certain treatments, according to global best practices that can make the person's life better.
So okay, that's actually a very good one. So for women that have given birth, so like I want to know, like, why is it that after childbirth some women get to feel pain during sex? How can a physiotherapy come in?
This is a beautiful question. And it's not just about women who have given birth, even women who have not given birth. There are two basic conditions that come to mind. Number one is vaginismus, and the second is dyspareunia. These are two main conditions that can lead to sex, pain associated with sexual intercourse. Now, the first one, or let me start with the second one. Dyspareunia means painful sexual intercourse. It means the man's, I don't know what to say now so that they will not ban your channel, but there's going to be penetration, right? But the penetration is painful. The intercourse, there's penetration, but the intercourse is painful. There's something happening there that's causing the pain. But for the first one, vaginismus, there is painful penetration. Remember, dyspareunia, painful intercourse. Vaginismus, painful penetration. So it means that something is happening within the muscles associated with the woman's private that will make penetration difficult and painful. Very painful. Now, usually, why does this happen? Especially pregnant women, postpartum, women who have given birth. That place experienced a significant amount of trauma. Muscle has memory. Muscles have ability to retain, certain information. So something that happened or passed through, a traumatic event can cause stress disorders for a muscle group. Post-traumatic stress disorder can happen inside muscles, and then they begin to contract in response to any movement there. So any form of penetration, anything that looks like it's going to pain, the whole system is contracting in fear, and that can result in a lot of pain. Now, what physiotherapists would do is to start rehabilitating, is to start, a journey of repair, right? And gradually, starting from the assessment of this, to know what it is and the grade. There are like 5 grades from 0 plus 1 plus 2 plus 3, to 5 grades of vaginismus and dyspareunia. The pelvic floor muscle strength assessment. You want to know how the woman responds to penetration. So from that point, to the actual treatment, we use gradual. There are many treatment options to actually help. The ones who are experts in that field, they do the internal work, they do the pelvic floor work, gradual penetration and all that, re-educating the woman, encouraging, and using some tools to make the place to relax the muscles around that. Now it's different from a conventional pelvic exam. A pelvic floor exam by a physiotherapist, a pelvic floor specialist, is very different from the regular pelvic exam in the sense that it is gentle and mild, and the lady has the consent. You have to give consent, and you can withdraw consent at any point. It's not rigorous, so it's going to be gently going through that region. And then, like I said, there are many options, there are many tools that can be used. We use therapeutic ultrasound, we use electrical modalities, we use manual techniques that can be administered by the therapist to actually help bring about reduce pain and improve function around there. So there's a whole lot we can do.
So like now, is there any specific like exercise? Like, can you just list like 5 exercises that they can give to those women that have given birth?
This question is very important because depending if the problem, because during a pelvic floor assessment, you want to ascertain 2 things. You want to know, is the pelvic floor relaxed? Is it too weak or lax? Or is it too tensed after recovery? Is it too tight and guarded? Is it spasming? Now, if the pelvic floor muscles are too tight, it will be counterintuitive. It will be bad to administer squeezing, exercises that make the woman squeeze. Why? You are worsening the tightness. You are worsening that area. It needs to relax. Okay? If the muscles there are lax, the ligaments, everything is weak and relaxed, it would not be nice to keep relaxing more. Talking about the exercises that can help. So I already mentioned Kegels exercise, which there's a lot of precautions to know. There's a lot of things that it's up to the physiotherapist to administer that. Then there's perineal stretches. There are different tools that can be used to help with stretching and then relaxing the muscles around there, depending on what it is. Remember, it can be tight, it can be loose, so it depends on what exactly we want to achieve with the pelvic floor. There are also even basic exercises like just walking, can help to increase blood circulation there and promote healing. So it's a group of things that can be offered. So yeah, that's I didn't mention up to 5, but there are many more.
Yeah. So lastly, like, what's the advice on people dying in silence in pain?
Oh, good. I stumbled on a study that opened, that said, first, 1 in 3 women who give birth come down with pelvic floor dysfunctions.
Oh.
So it's either they are leaking urine, urinary incontinence, or fecal incontinence. They are not able to control the sphincter, and they don't know. Maybe when they cough or sneeze, they leak, right? Or all these pelvic floor issues, pelvic pain and all that, pelvic girdle pain, all manner of issues. However, very few of those women, I think about 1 in maybe 20, I can't remember the exact stat, but very, very few of the women ever report their symptoms. Not just that, most of the women who eventually report after 8 years of seeing the symptoms.
Wow.
Why? Sometimes it's because on our own part as health professionals, we are not able to help them. We are not able to tell them what they need to do. Then, on the other side, they don't also have the right information because we don't tell them. Now, and then finally, some of them it's shame. What will people say? I don't want people to think that I'm going through this. I don't want people to know that I'm going through this because they think it's happening to only them. Okay, so I would advise mothers, ladies, women, if you're going through anything that you don't understand in your body, take it as a personal responsibility to come and report yourself. Come and tell the healthcare professionals what is going on with your body, right? One thing I can assure you is that there's help for you. There's help. There's actually remedies to a lot of things that you're going through. So, the second advice I would give is for you to also know more about your condition. Study more. Ask questions. Have professionals as friends. Have physiotherapists. Have doctors. Have dietitians. Have pharmacists as your friends that you can easily put a call through and say, okay, this is what I'm going through. What do you think? That may save a lot for you. It may save you a lot. And then finally, try to understand your path of care. If there's any professional that will be needed as part of your treatment, please feel free to request. It is your right and it's our responsibility to refer. So it's your right to meet your doctor, your GP, or your gynae and say, I think I need a physiotherapist. I've read somewhere, or I heard from TooHealthTalk that I may be needing a physiotherapy, a referral to physiotherapy or a physiotherapist service. So please, can you refer me? They'll gladly oblige. They would even be happy that you know what is expected in your care. So that's what I would give as advice. Don't suffer in silence. Don't die in silence. There's actually solution to whatever it is that you're going through.
And if you also have those solutions or in handling pain that you're looking for. So
Definitely.
yeah, so we've come to the end of today's episode, and I want to especially thank Dr. Chijioke for coming on the show today. It's not easy to bring you to the show with your busy schedule, and I'm so excited that you're here. So lastly, I want to thank everyone for staying up to this moment, and please like, share, and subscribe to the and tell people about how physiotherapy can help them handle their pain. Thank you very much. See you in the next episode.
Share, subscribe.
Bye.